Here's a fact that genuinely surprises most people. Under Original Medicare in 2026, there is no annual out-of-pocket maximum. None. According to medicare.gov, that means if you have a serious illness and you're hospitalized for months, your bills keep climbing with no ceiling. In this video, you'll know exactly what each path pays, the real numbers from 2026 CMS data, so you can understand the trade-offs clearly. Before we get into it, a quick note. Everything I share here is for educational purposes only. I'm not a licensed insurance agent or financial advisor, and nothing in this video is personal advice. Always work with a licensed Medicare professional for decisions about your specific situation. Now let's get into it. If you're approaching Medicare eligibility, or if you're already on Medicare and reviewing your options, the biggest question most people wrestle with is this: Original Medicare or Medicare Advantage, which one actually costs less? And the honest answer is, it depends on what kind of healthcare year you have. As of 2025, according to CMS data, more than 34 million Medicare beneficiaries, that's 54% of everyone eligible for Medicare, are enrolled in a Medicare Advantage plan. The other 46% are on Original Medicare. Both paths serve tens of millions of Americans. Both have real advantages, and both have real costs that most people don't fully understand until they're already enrolled. Today we're going to walk through both, what they cover, what the 2026 numbers actually look like, and where the key differences are. We'll run through two realistic cost scenarios using only CMS-published 2026 figures. By the end, you'll have a clear, accurate picture of how both paths work. Original Medicare has two main parts. Part A covers hospital stays, skilled nursing facility care, hospice, and some home health care. Part B covers doctor visits, outpatient services, lab tests, durable medical equipment, and preventive care. Together, they form the foundation of Medicare. According to CMS, the standard Part B premium for 2026 is $202.90 per month, an increase of $17.90 from $185 in 2025. Most people don't pay a premium for Part A, per medicare.gov. If they or a spouse worked and paid Medicare taxes for at least 10 years beyond premiums, there are deductibles. The annual Part B deductible in 2026 is $283 according to CMS. After you meet that deductible, Original Medicare typically pays 80% of approved costs, and you pay the remaining 20% according to medicare.gov. There is no cap on that 20%. It runs the full year. For hospital stays, CMS reports the Part A deductible in 2026 is $1,736 per benefit period. That covers your share for days 1 through 60 of a hospital stay. Beginning at day 61 per CMS, you pay $434 per day in coinsurance. Starting at day 91, you enter what CMS calls lifetime reserve days, and the daily coinsurance rises to $868 per day. For skilled nursing facility care, per CMS, days 1 through 20 are fully covered after the Part A deductible, and days 21 through 100 require $217 per day in coinsurance. Re-engagement, those numbers add up quickly, and the key thing to understand is that in Original Medicare, they add up with no ceiling. Let's look at how Medicare Advantage handles costs differently. Medicare Advantage, also called Part C, is an alternative way to receive your Medicare benefits. Instead of the federal government paying claims directly, you enroll in a CMS-approved private plan that delivers Medicare coverage. These plans are required by CMS to cover everything Original Medicare covers, and most offer additional benefits as well. For 2026, CMS reports the average monthly plan premium across all Medicare Advantage plans is $14, down from $16.40 in 2025. And according to CMS 2026 data, 67% of Medicare Advantage prescription drug plans charge no additional premium beyond the standard $2.90 Part B premium. So for the majority of plans, the monthly premium cost looks similar to Original Medicare on its face. Here is the critical structural difference. Medicare Advantage plans are required by CMS to set an annual out-of-pocket maximum. According to KFF's analysis of 2026 enrollment data, The average in-network out-of-pocket plans is $5,421. For plans covering both in-network and out-of-network services, that combined average cap is $9,825 per KFF. For HMO-type plans specifically, the average in-network cap is 4,630 type plans, 6,220 type plans per KFF 2026 data. Once you reach your plan's limit, the plan covers 100% of covered costs for the remainder of the year. So with Medicare Advantage, there is a ceiling on your annual costs. With Original Medicare alone, there isn't. That's the single most important structural difference, and it shapes every cost scenario we're going to look at. Per medicare.gov, Original Medicare does not cover routine dental care, routine vision care, or hearing aids. These are explicitly excluded from Part A and Part B coverage. For many people in the 65 and older age group, those are significant ongoing costs. According to KFF's 2026 Medicare Advantage analysis, 99% of Medicare Advantage plans offer some vision benefits, 98% offer some dental benefits, and 98% offer some hearing benefits, most with no additional premium. According to CMS, the average Medicare beneficiary in 2026 can choose from 32 Medicare Advantage plans in their area. An important context note here: some benefits doesn't mean unlimited benefits. Dental coverage under many Medicare Advantage plans is limited. It may cover preventive care like cleanings, but have annual caps on major procedures. Vision benefits may cover an annual eye exam and a basic eyeglass allowance. Hearing benefits vary widely. The specifics are visible on the CMS Plan Compare tool at medicare.gov Plan Compare, which shows exactly what each plan in your zip code covers at no cost, with no sign-up required. Medicare Advantage comes with two significant trade-offs that Original Medicare does not have: network restrictions and prior authorization requirements. Under Original Medicare, per medicare.gov, you can see any doctor, specialist, or hospital in the United States that accepts Medicare. There are no referrals required and no network to stay within. Medicare Advantage plans, per CMS guidelines, operate within defined provider networks. HMO-type plans typically require that you use in-network providers, and outside of emergencies, an out-of-network HMO visit may not be covered at all, per CMS. PPO-type plans allow out-of-network care but generally at higher cost sharing. If your doctor doesn't participate in a plan's network, you may face a different financial picture than you expect. Prior authorization is the second key difference. Under Medicare Advantage per CMS policy, plans can require advance approval before covering certain procedures, specialist referrals, and durable medical equipment. CMS finalized rules taking effect in 2026 that tighten decision timelines. Standard prior authorization decisions must now be made within 7 calendar days, and urgent requests within 72 hours. Those are improvements from the prior 14-day window, but they represent a review step that Original Medicare does not require. Let's make this concrete with two scenarios built entirely from published 2026 CMS and KFF data. Scenario A, a healthy year under Original Medicare. The annual cost for Part B premium alone is $202.90 multiplied by 12 months, or $2,434.80 per year, per CMS 2026. Add the $283 Part B deductible. For a healthy person with routine doctor visits, the 20% coinsurance on a typical office visit means modest out-of-pocket costs. Total annual spend for a generally healthy enrollee tends to stay in a manageable range. Under Medicare Advantage, many plans charge zero in additional premium beyond the $202.90 Part B premium. 67% of plans, per CMS 2026. Copays for in-network primary care visits vary by plan but are often in the $0 to $35 range. In a relatively healthy year, the two paths can look quite similar in total out-of-pocket cost. Scenario B, a serious illness requiring extended hospitalization under Original Medicare. CMS 2026 data shows a 90-day hospital stay would cost $1,076 for the Part A deductible covering days 1 through 60, plus $434 per day from day 61 through day 90. That's 30 days multiplied by $434, totaling $13. 020 in additional coinsurance for days 61 through 90 alone, per CMS figures. The combined hospital cost for that stay comes to approximately $14,756, plus 20% of any associated Part B outpatient costs with no cap, per medicare.gov. There is no ceiling under Medicare Advantage. For a comparable scenario, KFF 2026 data shows the average in-network out-of-pocket maximum is $5,021. Once an enrollee reaches that plan limit, covered services cost nothing additional for the remainder of that year. The specific limit varies by plan. Some plans set lower caps, some higher, but every CMS-approved Medicare Advantage plan must have one, per CMS rules. These scenarios use published 2026 CMS and KFF figures for educational illustration. Every individual's actual costs depend on their specific situation, the plan they are enrolled in, which services are used, and whether providers are in network. The purpose is to understand how the structures differ, not to project outcomes for any individual. Here's what we covered today. First, Original Medicare pays 80% of approved Part B costs after a $23 deductible in 2026, per CMS, with no annual out-of-pocket maximum. Part to hospital costs in 2026 begin with a $1,736 per benefit period deductible, per CMS, and coinsurance accumulates from day 61 onward with no ceiling. Second, Medicare Advantage plans in 2026 carry an average in-network out-of-pocket limit of $5,421, per KFF, and that cap is a structural protection Original Medicare alone does not provide. Average plan premiums in 2026 are $14 per month according to CMS, and 67% of plans charge no additional premium beyond the standard Part B cost. Third, Medicare Advantage typically offers dental, vision, and hearing benefits that Original Medicare excludes, but comes with provider network restrictions and prior authorization requirements that Original Medicare does not have. The right fit for any individual depends on their health, their providers, their medications, and their location, and that's exactly why CMS built the free comparison tool at medicare.gov/plan compare. If this breakdown helped you, subscribe to Medicare Max. I put out new videos all the time, built the same way every time. Verified data, plain language, no sales pitch. Coming up next, we're covering how Medicare Advantage networks actually work. If you've ever wondered whether your doctors take your plan, what happens when you travel, or what a prior authorization request actually looks like, you'll want to watch that one next. To compare plans on your own, the official Medicare Plan Compare tool is at medicare.gov Plan Compare. It's free, run by the government, and no sign-up required. You can also call 1-800-MEDICARE. That's 1-800-633-FAIR227. Available 24 hours a day, 7 days a week. A real person can answer questions about your enrollment status and current coverage.